All right, so last time we ended going through different white blood cells, then we ended right here starting with platelets. Again, in our blood, if we break down blood, we spin it out, we've got plasma. What's plasma mostly? Water. And I'm like, so we don't care a lot about that. Not that there's not important things in plasma, there are. And I'm like, but we're going to be looking at a lot of the actual blood cells. There's red blood cells, there's white blood cells, there's platelets. Last time we talked about a whole bunch of all the, the 5 most common, or not the most common, the 5, I'm like, white blood cells, and I'm like, and what they usually are responsible for. Today we get into our last of our fragments, or our last of our cells that we find in blood, which are the platelets. Now, a platelet itself is not a cell. It was a cell, but now it's a fragment of a cell. So there's cytoplasmic fragments of a megakaryocyte, which just sounds like a really big thing. Now, when we make blood cells, whether they are red blood cells, whether they're white blood cells, or whether they are plasma or platelets, they're all going to start off as a stem cell. The official word is a hematopoietic stem cell. The word itself just means the making of blood cells. Like poiesis means making, anything heme is blood. It all starts off with a stem cell. Now, these stem cells will develop into megakaryocytes. And yes, at some part along the way, they're either going to become a white blood cell or red blood cell, or if you're a fragment, we're going to take this megakaryocyte and it starts to break apart, and you end up with these tiny little fragments that we call platelets. Now, just because they're a broken up cell doesn't mean they don't do anything. They help us with all of our blood clotting. Now, so that we don't have blood clots everywhere all the time, and I'm like, because these are always circulating around in our blood, ready to go when needed, and I'm like, we have nitric oxide in our blood that just kind of keeps these at bay so they don't have clotting that happens when they shouldn't. Also, the fact that the cells that line our blood vessels, if there's no damage to them, the platelets don't stick to anything. So we've got nitric oxide and the fact that the cells in our blood vessels aren't lined. Platelets don't do anything. They circulate around and are waiting, and I'm like, for some type of damage to a blood vessel. Now, because they're not a real cell, like they were, but they're not a real cell, they don't have a big nucleus, they're not making ATP, they're not, don't have all their normal organelles, they don't live for very long. And I'm like, they only last for about 10 days. So we're constantly making new ones to replace the ones that are broken. And the hormone that triggers the making of more platelets is called thrombopoietin. Again, anything with that poietic, poiesis, poietin means making. And I'm like, it's just a hormone. Anything throm means clotting. And I'm like, it's just the making of clotting cells. So it's just a hormone that triggers the making of platelets or our clotting cells. Now, why we care about it is, I'm like, if we do have damage to our blood vessels, clotting is one of the ways that we can prevent blood loss. Now, hemostasis, the word itself just means blood state, or keeping the same amount of blood in our system. We don't like to lose a lot of blood. And I'm like, and there are various things that can try to slow that down, including clotting factors and platelets. However, the clotting itself, there's 3 steps to try to slow down blood loss. What step is clotting? Which step, though? I know, but like 1, 2, or 3. It is 3. The official word for blood clotting is coagulation. Anything coag means like thickening and sticking together. There are 3 steps to ultimately try to slow down blood loss. The actual clotting itself doesn't even come into form until step 3. The first thing that happens if we have damage to a blood vessel is vascular spasm, aka it's constriction, vasoconstriction of a damaged blood vessel. If you cut or damage a blood vessel, the thing, because I'm like, there's blood flowing through there, to try to slow down the amount of blood that leaves through that damaged blood vessel, is we can constrict that blood vessel. So there is less blood flowing through it, aka less blood that can now leave the body. Now, things that are going to trigger it, and that are going to trigger that constriction of the blood vessels, if you have damage to any type of vascular smooth muscle, because we can find smooth muscle lining all of our blood vessels. And I'm like, our endothelial cells that line our blood vessels, they can submit chemicals, and I'm like, as well as platelets, to try to trigger this vascular spasm, and pain. And I'm like, because usually if you get a cut, you also have pain. The pain will also trigger that constriction of the blood vessel. Now, it's most effective in smaller blood vessels. And so I'm like, a lot of your veins, and I'm like, arteries a little bit. And I'm like, but if you have some type of damage, you know, if you get shot or stabbed, whatever, not that any of you guys are that's gonna happen. But I'm like, if you would have a severe damage to, say, your aorta, do you think our body can constrict the aorta enough to prevent blood loss? No, it is too big of a blood vessel, and the pressure that the blood is, you know, that's in that particular blood vessel is too strong. It may try to constrict it a little bit. It's not enough that you're going to survive. And I'm like, but smaller blood vessels, a lot of our veins, and I'm like, if there's damage to it, they can constrict it, at least slow the blood far enough down. And I'm like, that maybe you can get to the hospital in time. And I'm like, or if it's just a small little vein, and I'm like, you know, it's enough that it'll eventually slow it down enough that steps 2 and 3 can stop blood vessels or blood loss. Now, and I'm like, this, if it doesn't work, we can help, you know, increase the amount of vascular constriction. And I'm like, because if you come across someone, they're bleeding, what do they tell you to do? Apply pressure. And I'm like, is you're squishing that blood vessel, because the blood vessel itself is trying to constrict, but it's obviously not enough if they're still bleeding out. And I'm like, when you put pressure on the blood vessel, you're constricting that blood vessel to try to slow down loss. And hopefully you're constricting it enough, and I'm like, that it slows blood loss enough that steps 2 and 3 can hopefully get caught up, and I'm like, and stop that blood loss. Now, because people are curious people, you know, and you apply pressure, people always want to know, did it work? And what are they going to do? I'm like, they're going to release the pressure, pull it up, and now you just started all that blood flowing again. And I'm like, they always say, I'm like, you know, even if you've got blood soaking through everywhere, don't lift your hand up, you know, just keep putting more pads down, more gauze down, whatever it is. Don't look and try to be curious. And I'm like, unfortunately, I'm like, you just open it right back up again. Now, if we can constrict it enough, or, you know, whether you're applying pressure or your blood vessels are doing this themselves, and I'm like, the first step that's going to happen when that blood flow slows down enough is we can form a platelet plug. Yes, platelets are going to stick to the broken blood vessels and form a temporary plug. It's not a permanent, but it's like a quick, let's try to stop blood from flowing out. Now, what triggers it is that when here's the white blood cell, or not the white blood cells, here's our smooth muscle of our blood vessel. If we've cut it, if we've damaged it, you are now exposing the collagen fibers that are in the blood vessels. It's only when we expose collagen fibers that platelets can stick to those. Platelets cannot stick to the normal smooth muscle, and I'm like, that lines our blood vessels. Platelets can stick to the collagen that's only exposed when there's damage. And so once you have those collagen fibers exposed, platelets are going to stick, and they stick using, it's called the von Willebrand factor. It's just a protein. And some guy figured it out whose last name was von Willebrand. I would call it them myself too if I, you know, discovered something. And they stick to those collagen fibers. Now, as they start to stick, they do start to swell up. They start to get a little spiky. They get other things sticking out from them, and it causes other platelets to try to all stick together. Normally, platelets do not swell. They normally are not sticky, or you would have platelets sticking to each other everywhere. And like, it really comes down to exposed collagen, platelets stick there. Then they start to kind of go into action. I need to get bigger. I need to become spiky. I need other friends to all stick together, so that they form this initial platelet plug to try to slow down blood loss. Now, it is a positive feedback, because as platelets are now coming to this area and sticking, and like, they're releasing various hormones and chemicals that are triggering more platelets to go to that particular area and stick together to try to prevent that blood loss. And I'm like, so it's a positive feedback. I would not ask you the various hormones. As long as you know it's a positive feedback, platelets sticking to the collagen will eventually trigger more platelets to go to that area and stick together to form that platelet plug. That platelet plug is not a permanent awesome fix. It's just kind of like a quick fix, slow the blood loss down. It's not until you get to step 3, that actual blood clot, that this is what's going to form a more semi-permanent, I'm like, stoppage of blood on that blood vessel. Something that can stay there and I'm like, prevent blood loss while those blood vessels are repairing themselves. So it can stay there for a few days. Now, this is taking the platelets that are already there, as well as a few other things, and we're adding fibrin threads. Based on their name, they're very fibrous. Those are fibrin threads. It transforms blood from this area, into kind of a thicker gel. Things get stuck. What are all these things getting stuck? Red blood cells. They're red for a reason. And I'm like, so you're going to have platelets in the area. You're going to have fibrin threads near this broken, damaged blood vessel. And I'm like, with all these fibrin threads, you're going to attract other red blood cells that are floating around. They get stuck in there, and they form this semi-permanent blood clot. Now, and I'm like, there, yes, are a whole bunch of different chemicals that are going to make all of this happen. And I'm like, the first thing, you have something called prothrombin that gets converted to an enzyme called thrombin. Pro just means like initial, pre, it's almost like saying pre. It becomes thrombin, and this thrombin hormone eventually catalyzes fibrinogen, anything gen means making, which makes fibrin. It's that makes all those fibrin threads. So there's various hormones that eventually trigger the making of these fibrin threads that, again, covers up where those platelet plugs are, catches some red blood cells, catches some more platelets, and this is what forms your clot. This is also what forms, if it's on the surface of the skin, your scab as well. Now, so there's kind of your 3 basic steps if you get a damage to your blood vessel. Vascular spasm. It's trying to squeeze it closed to slow down blood loss. Then, while it's trying to squeeze it, and I'm like, you've got platelets starting to stick to that damaged blood vessel, sticking to the collagen, and I'm like, and they like to all stick together, and then we start to make those fibrin threads, and I'm like anchoring that platelet plug in place, as well as possibly catching a few other blood cells in there as well. It's when it's this big blood clot, that's the semi-permanent fixture that's going to stay there, and I'm like, as that blood cell eventually repairs itself. That could take a weekish, and I'm like, kind of depends on how much damage has been done. There's an actual picture of big old blood clot, some fibrin threads with some red blood cells in it. But eventually I'm like, well, wait a minute, I'm like, at some point, and I'm like, that clot has to start to retract. So it forms this big old, kind of Band-Aid on the open wound, but it does start to retract. It starts to kind of pull away. There is actin and myosin in here. Like same things we find in our muscles that allow us to contract. We also find actin and myosin in platelets. About 30 to 60 minutes after we form that semi-permanent clot, they start to pull in on itself. One of the things that does, I have the picture if I go back, and I'm like, there's a gap in here. Is a gap good? Now, what would we like to do to that gap? Close it. And I'm like, after this clot forms, about within an hour, it starts to try to pull itself together. It starts to retract. And when it does that, it does try to pull those 2 pieces, those 2 broken areas. It tries to pull it together to make a nice tight seal. That's going to heal a whole lot faster than having this entire open gap. And so clot retraction is, pulling on those fibrin threads and drawing those blood vessel edges together so that it can heal a lot faster. But then we have to get rid of it. Because blood clots we don't want forever. We want them there just until that blood vessel heals itself. Then we want it gone. The whole getting rid of the blood clot completely is called fibrinolysis. Anything lysis means breaking down. Fibrin is we want to break down those fibers in the blood clot. Now, it starts within about 2 days. And I'm like, again, it doesn't end in 2 days. And I'm like, because your blood vessels may still be healing themselves. So we have more hormones. And I'm like, plasminogen, anything gens means like beginning or making. Plasminogen becomes plasmin, and as well as thrombin. Between these 2 hormones, plasmin and thrombin, and I'm like, we start to break down those fibrous threads. We start to break down the blood clots. Now, if we didn't break the blood clots down, what would happen? if we never broke blood clots down? We'd end up with blockages everywhere. And I'm like, you hear problems, people have problems with blood clots. And I'm like, yeah, it probably stems from somehow, they may be making blood clots when they shouldn't. And I'm like, or they don't have hormones enough, and I'm like, they don't have the plasmin, they're not breaking them down fast enough, and we can have blood clots floating around in our blood vessels. That's never good either, because they could form a blockage, and blood can't get where it needs to go. Now, some factors to prevent undesirable clotting, because we don't want blood clots if we don't need blood clots, because they can cause problems then. One, and I'm like, things to try to slow that down, platelets are not going to stick to each other, or they're not going to stick to a blood vessel. And I'm like, they won't stick to the blood vessel wall unless the collagen is exposed. And so that smooth endothelial lining in the blood vessels prevents platelets from sticking. The platelets need to stick to collagen. We have antithrombic anti-clotting substances, nitric oxide and prostacyclin, that are secreted by endothelial cells. Both of these keep platelets in check so they're not attaching or sticking to each other. And vitamin E is a anticoagulant. And I'm like, people that suffer from lots and lots of blood clots, they need to start taking more vitamin E. They're probably given some type of supplement to try to prevent blood clots. Now, there was another vitamin, and I'm like, we'll get to it later. There was another vitamin that helps in blood clotting. Where is it? Vitamin K also helps in blood clotting, because I'm going to mention it. I don't remember which slide. I'm going to mention vitamin K is needed in blood clotting. And I'm like, because, we can use vitamin K to our benefit later on. Now, some problems with blood clotting, because again, yes, you can have problems with clotting. Clotting's great. It can stop us from bleeding out. I was going to say a thrombus. Again, a lot of things, anything throm has to do with clotting. A thrombus is just a clot that develops and persists in an unbroken blood vessel. Again, clots should not be able to form or stick unless you have those exposed collagen fibers. Shouldn't. However, in some people's cases, it does. And I'm like, they're making extra hormones, and I'm like, that's triggering these platelets to form and stick together, and they have clots in blood vessels that aren't broken. Now, those can start to circulate around in your body, and yes, they can form blockages in various parts wherever they end up. And I'm like, and if you have a blockage in your blood vessel, oxygenated blood can't get where it's supposed to go. It can lead to tissue death. Never good. Now, that's just a clot that's in an unbroken blood vessel. It does start to circulate around in your bloodstream. We do call it an embolus. I'm like, anything heme or heme has to do with blood. And I'm like, anything ball means like a ball, just like a blood ball. It's a clot. And I'm like, so when that thrombus breaks away and starts to circulate around, we don't call it a thrombus anymore, or clot, we call it an embolus. It's floating around. When it actually does start to obstruct a blood vessel, we call it embolism. Now, the two most deadly embolisms are pulmonary embolisms and cerebral embolisms. Now, if you have a pulmonary embolism, what's that? Or what does it affect? It affects the lungs. Now, lung tissue will start to die. That's not good, because we need lungs to get oxygen for everywhere. And if you have a cerebral embolism, where's that? In the brain. Now you have a blockage in one of the blood vessels, including it could be an artery to your brain. That means now you don't have oxygenated blood that's going to the brain, and yes, it can cause brain tissue death. Risk factors for people that can develop these clots, unnecessary clots. And I'm like, it's atherosclerosis. I'm like, it's hardening of the blood vessel walls can cause it. Any type of inflammation in your body could trigger the making of blood clots when they shouldn't. And slowly flowing blood or blood stasis from immobility. And I'm like, so if you are not moving for a long period of time, your blood kind of gets sluggish, and it gets really slow if you're just laying around and not doing anything. And I'm like, that could form unnecessary blood clots in your body. You want blood to constantly be circulating around nice and fast and nice, upbeats, blood pressure. If it's too slow, you can get blood clots. And I'm like, examples, and I'm like, people that have just had, and people complain about it all the time until you tell them why. People that have just had open heart surgery. where they had to cut right through the sternum. Now, when you cut, that's a huge cut. I'm like, when you cut, are you, and they have to cut through bone, do you only cut through bone? What else are you cutting through? Muscles and tissues, and what do we find giving oxygen to all of those? Blood vessels. And I'm like, you're cutting through lots and lots of blood vessels as you cut through any part of the body. Any surgery, you're going to be cutting through blood vessels. That means now if you cut through blood vessels, what will your body try to form? It will try to form blood clots. So, and I'm like, that's naturally going to happen. I'm like, any type of surgery, you cut through blood vessels, your body's going to want to clot that particular blood vessel to stop the blowing of blood. Great. However, if you've just had open heart surgery, and the next day, and I'm like, big, huge cut, you actually use steel wires to put it all back together, are you going to want to get up and walk around? And like, let me go for a walk. Nope. However, what's the nurse, if you're going into nursing, what's the nurse going to make you do? Get up and walk around. Day after open heart surgery, the nurse, and those patients hate the nurses, and I'm like, are going to make you get up and go for a walk even though it's super painful. And most patients are like, why do you want me to be in pain? It's not that they want you to be in pain or you want the patients to be in pain. It's to stop those blood clots from forming and breaking free and traveling throughout the body. You are going to have, a patient's going to have blood clots. However, if they start to hang out and I'm like too long in non-mobile area, you can have additional blood clots forming where they shouldn't. And I'm like, or these big blood clots could break away and start traveling around the bloodstream before they get broken down. And I'm like, so you're preventing blood clotting from them dying. Mm-hmm.
At Vascular workout, we have these what are called SCDs. Yeah, and they just do compressions. How come they only have their legs?
And I'm like, the legs is one of the biggest places where you can have blood clots that are happening. And I'm like, mostly because they've got big, huge areas of blood vessels, and because your blood is flowing the slowest in your legs. And I'm like, which is one of the reasons I'm like, people that usually suffer from blood clots have to usually have some type of compression socks or something like that. And I'm like, it just helps keep their blood flowing in a little more streamlined area. And I'm like, it's the slowest flowing blood in our body. So it's the top area for getting blood clots. Now, some anticoagulant drugs. If you just had open heart surgery or some other big surgery, and I'm like, or if you were prone to blood clotting from some other type of reason, there are some things that they can give you to try to prevent too many blood clots, and I'm like, or excessive amount of blood clots. One is aspirin. It thins the blood. It allows things to flow through a little easier. And another one's called heparin. It's an anticoagulant. They usually give it to patients before and after surgeries, especially in any type of open heart surgeries. And I'm like, and then warfarin, also known as Coumadin, and I'm like, are for those that are prone to atrial fibrillation. This is the heart's not beating regularly. And I'm like, again, could be some type of clotting issue. And it interferes with the action of vitamin K. Vitamin K is necessary for blood clots to form. And I'm like, warfarin prevents the vitamin K from making the blood clots. Now, my random factoid, ready for my random factoid? That's not completely anatomy-wise, human-wise. And I'm like, but if you've ever had, mice in your house, and you put out the little dishes of mice poison, and you guess what's in it? Nope, opposite. Is warfarin or Coumadin is actually in that rat poison. Now, if a rat eats this, it prevents rats from making any type of blood clots whatsoever. And I'm like, and rats are bumping into things all the time, and they cause tiny little tears inside their blood clot or in their blood vessels. And I'm like, if they can't clot any of their blood, they will actually die from internal hemorrhaging. That's how your mice die if you feed them rat poison. You're giving them that. However, if you've ever had a pet, and I'm like, yes, it's for it's for mice. However, if you have a cat, because the rat poison, warfarin or Coumadin, I don't think it has any particular smell, so they give it some smells to make it, taste good and, attract the mice, which could also attract a cat or dog. And I'm like, cats or dogs are known to go after the rat poison and eat it, which means the exact same thing will happen to your cat or dog. So, and I'm like, and I've heard of stories, has anyone had this, that they've had a pet die from eating rat poison? Not die, but almost. You got it to the vet in time?
No, she just like swelled up real fast and then we just gave her
Vitamin K. I was going to say, I'm like, because if you know all of a sudden your pet ate a bunch of rat poison or mice poison or whatever, yes, they could easily die from internal bleeding. If you can get it to the vet fast enough, they're going to give them a whole bunch of injections of vitamin K just to offset, then I'm like, the warfarin or the Coumadin they ate. So that's it's like human anatomy, but save your pets. And so like, if they eat rat poison, just get them to the vet right away. And I'm like, but sometimes if you can't get them fast enough, it happens. They die from it. Isn't that fun? I just saved your pets in the future. Now, some other bleeding disorders, if you've ever heard of hemophilia, it means that somewhere along the lines, people that are hemophilic, and I'm like, are missing a blood clotting factor. I'm like, whether it's there's certain vitamins, certain chemicals, certain hormones, they are missing something in the process of making blood clots, meaning their blood cannot clot if they have damage to a blood vessel. So if they get any damage to blood vessels, they're going to have prolonged bleeding, especially in joint cavities. I'm like, you don't even realize that, yes, as you're running around and I'm like jumping up and down, you may be breaking tiny little blood vessels internal. Not enough to even do any damage or even cause, any type of bruising, but it's enough, and I'm like, that if you can't clot it, you have hemophilia, you're missing clotting factors, and I'm like, you can have internal bleeding and you can die from excessive blood loss. Now, if, luckily, it's a genetic thing, and I'm like, so hopefully somewhere along the line you knew that this was somewhere in your family, you can get tested for it before it's too late. And I'm like, they will give you plasma transfusions, and they will give you injections of, like, hopefully they can pinpoint what factor it is that you're missing, and then give you those factors. Other than having certain proteins in your blood, your plasma, there's a reason why they pay you so much. And I'm like, for your plasma, when you donate, I still have a big old scar. And I'm like, but one, they're looking for proteins in there to help with blood pressure. Two, they're looking for some of these clotting factors that are found in plasma. I'm like, so it's in your plasma that supplies some of these clotting factors. But yes, if there's someone with hemophilia, they can give those clotting factors to the people that have hemophilia. However, anytime you have any type of blood transfusion, even if it's plasma, you always have an increased risk of getting hepatitis or HIV, or if that's going down, way down, there's so much more extensive testing before they just give anyone's blood these days. But there's always an increased risk. Now, transfusions. If you have to get someone else's blood or give to someone else, and I'm like, if you've had too much blood loss, and you have to have full blood transfusion, and I'm like, they can give you whole blood, or they can give you packed red blood cells, which means they just got rid of the plasma and they get rid of the white blood cells. Because the red blood cells really are what are carrying oxygen. So if you've lost blood cells and enough of them that you're now going to have tissue death because you don't have enough red blood cells, they can give you extra red blood cells. Has anyone ever donated and they've done the double unit? No? Well, if you ever donate blood, they may ask you, and I'm like, would you like to donate a double unit? They'll remove the plasma from your blood, and they'll give you back the plasma, and like they split it, and they just take the red blood cells. And so you can donate just red blood cells to someone as well. However, if you receive or give someone the wrong type of blood, it can be fatal. So we'll talk about some of the different blood groups. Now, all together on a red blood cell. Here's my red blood cell. There you go. It's beautiful. It's got a little indent. And I'm like, there are 30 different antigens. There are 30 different types of proteins that hang out on the edge of it. And I'm like, that are unique to you. And I'm like, depends on which 30 types of proteins or antigens you have. Which means if you give your red blood cell to someone else, they would recognize that as foreign, and vice versa, because of those different antigens. Now, anytime we start to recognize the antigens, I'm just going to be like, look, here's an antigen. It's my square thing. And I'm like, here you go. I'll draw another shape because there's like 30 different ones. I'm not going to draw 30 shapes. But if someone else's plasma recognizes that, and I'm like, it causes clumping of blood, it's called agglutinations. I'm like, we'll get more into this in a second. But any other body would perceive that as foreign. They don't recognize squares. They don't recognize triangles because they don't have squares and triangles on their blood. It can cause clumping of blood. Clumpy blood is not good. And I'm like, and yes, and I'm like, it can, if given enough of the wrong blood type, it can cause death. Now, yes, there are 30 different types of antigens, squares, triangles, circles, whatever shape I wanted to draw, that can be used, and I'm like, to distinguish your blood from someone else's. However, there are, and I'm like, really, I'm like, 3 specific antigens found on your blood that we say that this is your blood type. So it's not the only antigens on your blood, but there are 3 antigens we're looking for to determine your blood type. Any guess what they are? Or what one of them is? They're letters. O means nothing. And I'm like, there's the RH factor. It's, you know, because if you're given a blood type, does anyone know their blood type? Who knows one of their blood types? What is it? A plus. And I'm like, which means A, O's on it, and the plus means the RH. It's either you have the RH or you don't. But we're going to go through these different ones. So different blood types you can have. You can have just A. You can have just A. You can have both A and B, your blood type AB. Or you can have neither A or B, which means your blood type O. Then we look to see, because it's not up here yet, we look to see if you have the RH factor. If you do, we call your blood type positive. If you don't have that RH antigen, we call you blood type negative. So you're always given a letter and then a plus or minus. A letter and then you have it or you don't. It's plus or minus. Now, there's 2 different words, means the same thing. And I'm like, well, we've got antigens. I'm just going to put them up here because they mean the same things. And I'm like, and I see it used interchangeable. Antigen is the exact same thing as a glutinogen. They both end in gen. They mean the exact same thing. These are the things found on the red blood cell that say that, oh, you have A's on your red blood cell. Those are A antigens. That's your blood type A. Now, in your plasma, you have antibodies, and its alternate name is agglutins. They mean the same thing. Antigens or agglutinogens are on your red blood cells. Antibodies or agglutins are in the plasma. So 2 different places. Now, if an agglutinin and an agglutinogen, or an antigen and an antibody of the same type see each other, it's like, I have A antigen and I have antibody A. They're both A's. If they see each other, they stick, and your blood is clumpy. Is that good? Nope, we don't want clumpy blood. This is showing what's on your red blood cell, and I'll draw it as well. I wish I had more whiteboard. And I'm like, and what's in your plasma? I'll start with blood type A. That's what Michael's. Anyone else blood type A? They know? I'm A as well. I'm A negative. Now, on a red blood cell that is A, that just means, or if you're blood type A, that just means on the red blood cell, there are A antigens all over it. That's like, oh, look, blood type A, A antigens on it. So I drew A's. Now, antibodies. You have a choice of antibody A or antibody B. What antibody do you think is in the plasma? Antibody? A or B? B. Why not A? They'd be the same and they would clump. Your blood would clump with itself. And so I'm like, you always have the opposite antibody for whatever antigen you have. Now, if I'm going to have to write smaller. If you are blood type B, I know this is up here, I'm just drawing it out anyways. If you are blood type B, here's your red blood cell. You have B antigens all over the red blood cell. Blood type B. What antibodies? You have antibodies A. Again, they have to be different. Now, if you're blood type AB. What's on your red blood cell? A and B. You've got both on there. What's in your plasma? Nothing whatsoever. Nothing. You can't have antibody A because it would recognize that in clump. You can't have antibody B because you have the antigen B. It would recognize itself in clump. And I'm like, so you have no antibodies whatsoever if you're a blood type AB. Now, if you're blood type O, what's on your red blood cell? Nothing. You've got like the most boring red blood cells. It's awesome. And Red Cross will call you all the time to donate. You have nothing on your red blood cell. I was thinking it kind of looks like an O, but stretched out. There's nothing on it. What antibodies do you have? You have both antibodies A and B. Not going to cause any problems for you because you don't have anything on your red blood cells to cause any type of clumping whatsoever. Now, if you were blood type O, you are considered the universal donor. Because your red blood cells are boring, that's not a bad thing. And I'm like, your blood cells are boring, but that's good because, and I'm like, anyone can receive your red blood cells. It does not matter if you're blood type B or AB. It does not matter. And I'm like, because whatever antibodies anyone else has, there's no clumping that's going to happen. You just get the red blood cells. Nothing's going to recognize it. And I'm like, because there are no antigens on it. So you're the universal donor. Is anyone blood type O in here? Does the Red Cross call you all the time? I was going to say, they always call blood type O. They call me all the time, and I'm A. I'm not even, I'm like, I'm pretty common on there. Maybe not all that common. Now, and I'm like, the universal recipient is if you were blood type AB. So if you're blood type AB, anyone here that's AB? It's the rarest one. And I'm like, you're known as the universal recipient. You can receive anyone's blood type, because what do you not have? You don't have any antibodies. You can receive anyone of any kind whatsoever, because you have no antibodies that's going to recognize anyone else as foreign. Now, kind of my little flow chart to know who can donate to who is if I start off with O. If you are blood type O, who you can give to A, you can give to B, and you can give to AB. Again, you're the universal donor. You can give to anyone. If you were blood type A, you can give to AB. If you were blood type B, you can give to AB. This is who you can give to. Now, can the arrows go in reverse? Nope. This is a one way, and I'm like, who you can receive from? Again, if you're blood type AB, you are known as the universal recipient. You can receive from anyone. If you're blood type O, you can give to anyone. And I'm like, but the arrows can't go backwards. And then there's that pesky thing of, do you have the Rh factor or don't you have the Rh factor? It's again, you either have it or you don't. We call it antigen D. And I'm like, but it's the Rh antigen. There's that one additional. You have AB, and then whether you have the Rh or you don't. 85% of you have the Rh factor, which makes me unique because I'm Rh negative. Now, you don't normally make antibodies in your plasma. You're not born with antibodies. I'm blood type A, I already said already. But if I was blood type B, I would be born with antibody A. And I'm like, in my plasma. The Rh, and I'm like, we'll just say, here's my red blood cell. If you have the Rh antigen, as I don't, but which is fine. Oops, it should be lowercase h. Not that. But I'm like, if you have the Rh antigen, first, do you have antibodies against it? What do you think? You wouldn't have any antibodies against it, mostly because they would cause clumping. I'm Rh negative. I don't have any Rh factor on here. However, when I was born, like I left it up there. I still don't have Rh antibodies. The only time that my body will start making antibodies for Rh is if my body has been exposed to someone that has a positive blood type. It's only when my body was like, well, look, I just got a red blood cell, and someone had that on it. Then my body be like, oh, yeah, that one thing. I should start making antibodies. You're not born with the antibodies. And really, the Rh factor usually only comes into problems with pregnancy. Now, it's called erythroblastosis fetalis. None of it sounds great. And I'm like, anything erythra is red, blast is making. And I'm like, fetalis, it affects the fetus. And I'm like, and yes, it can cause problems with red blood cells. Now, I have 2 kids, so that's why I can use this story for my benefit, because I am Rh negative. Now, I got pregnant with my first kid, a daughter, and I'm like, during delivery, there is going to be some blood crossing between mom and baby. And I'm like, and so during delivery, and I'm like, at some point my body was exposed to my child's blood. Now I have no idea what blood type my husband is because he's afraid of needles and won't let me blood type him. And I'm like, so we're going to pretend he's positive, because 85% of people are. And I'm like, and so we're going to say that my kid, my first daughter, had the Rh antigen on her. Now, great. However, she's going to be born fine. However, my blood is now going to see that Rh antigen that I got because I was exposed to my daughter's blood. And what am I going to start to make? I'm now going to make antibody Rh in my plasma. Now, second kid comes along, because I do have 2 kids. Second kid comes along, and I'm like, a lot of times I'm like, yes, during childbirth, but sometimes in the 3rd trimester, there can be some blood crossing between mom and fetus. It can happen through the placenta. If my blood has antibody Rh in it, and my second child has red blood cells that have the Rh in it, what's my body going to do to those red blood cells in that fetus? It's going to attack them. And I'm like, it's going to think they're foreign. It's going to cause clumping in the blood of a fetus. Is that good to have a fetus with clumpy blood? No. And I'm like, 1, it has clumpy blood, and 2, it starts to break apart the red blood cells. And I'm like, the fetus, because red blood cells carry oxygen, the fetus will not get the oxygen they need. It can cause permanent brain damage. It can cause death. It usually causes more permanent brain damage and some type of birth defects. And I'm like, because of that lack of oxygen. Now, this can all happen. We know all this. However, they now will give you something at the hospital. It's called Rogam. It starts with the RH. And I'm like, they will give you, it's a really big shot. I'm like, they will give you this Rogam serum that contains antibodies that are going to bind up the RH antigens. And I'm like, in my body. And I'm like, so it won't affect the fetus's body. It's almost like, I now have RH antigens in my body. They will give you RH antigens. And my antibodies will work on my own blood. It will not affect the fetus blood. However, because you are given some of these RH antigens, I would blood type A positive if they tested my blood right after that, the shot. And I'm like, but it just keeps your antibodies, the mom's antibodies away from the fetus so that there's no problems. Now, if I went to the hospital and I'd be like, my husband's blood type is A negative or B negative or whatever. So if my husband's blood type is negative and I'm negative, is there a chance that the baby will be positive? No, it's not math. 2 negatives don't make it positive. And I'm like, there is no chance that a baby will be positive. So if I went to the doctor and said, my husband is blood type A negative and I'm A negative, I really don't want that shot. Will they not give it to me? They're still going to give it to you, no matter what. And guess why? No. To be safe, how? If there's no possibility, if my husband is type negative and I'm type negative, there's no possibility that that baby's positive. Why are they going to give you the shot anyways? You already heard my story. And I had heard. And I'm like, they will not believe me. They will not believe. They will never take a mom's word that that's actually your husband's kid. They don't know, and if they don't give you the shot, and I'm like, and all of a sudden your baby either died or has some type of severe mental, problem later on in life, that's a lawsuit. Instead, they're going to be like, oh, that's great. We're giving you the shot anyways. And it's a really big one, and they put it in your butt muscle. And guess why your butt? I asked. I'm nosy. Why? Not the fat. Big muscle. And I'm like, because it is an intramuscular shot, that if they put it in your arm, there's so much fluid. I'm very nosy when I go to the doctor. And I'm like, I looked at it, and then they're like, if we put this in your arm, you would have a bulge of fluid if we put it in your arm muscle. So they put it in a really big muscle in your butt muscle. And I'm like, and then it hides itself underneath the fat, and then you don't notice it, but it's just a lot of fluid. But they give you the shot anyway. So if you're a female and you are blood type negative, and you get pregnant, expect a shot. They also, if I said, well, this is my first kid, I don't need the shot yet, are they going to believe you that this is your first kid? No, they have no idea. And you may have had a miscarriage somewhere along the way that there might have still been a blood transfusion, and you might not consider that as like, this is my first pregnancy. They will give you the shot no matter what. Yay for you if anyone's blood type negative. And I'm like, if the dad's negative and the mom's positive, it's a possibility that the baby's negative. But there's no reaction that happens. And I'm like, the baby's blood isn't going to do any big damage to the mom's blood. Right. It only causes problems to the baby if the baby's negative. If the mom's negative and the baby's positive. Now, and I'm like, as we said, I'm like, blood typing A, B, and I'm like, and the RH factor, these are the big ones for being able to donate blood and give blood. However, and I'm like, there's some other things, and I'm like, that they look, again, there's 30 different antigens, and so there's other different things, and I'm like, they can look at. But if you are given the wrong blood type, and I'm like, things that can happen, I was going to say, well, one, the donor cells are going to be attacked by the recipient's plasma antibodies. And so, and I'm like, I'm just going to use get rid of. And I'm like, if I'm blood type A, there's my blood type A, what antibodies do I have? B. Now, if I was given, and so I'm like, there's my blood, but I was given some foreign blood. Here's my foreign blood, so it's tiny and it's black. I'm like, if I was given blood type B, the donor's cells are going to be attacked. And I'm like, so these cells are going to be attacked by that antibody. They will clump. They will destroy. Neither are good. And I'm like, agglutinate means a clumping. The word glue's in it, sticking. And I'm like, and these clumping things can start to block blood vessels, just like a clot would block a blood vessel. They can also start to rupture the blood vessels and release hemoglobin in your bloodstream. Too much of it, and I'm like, you reduce your oxygen carrying capacity, because hemoglobin is actually what holds oxygen molecules. And so your effects, and I'm like, you have a decrease of oxygen carrying capacity. I'm like, you're probably going to feel really tired, really sluggish, because you're just not getting enough oxygen. And I'm like, you're not going to have as much blood flow beyond the blockages. Again, it can start to cause tissue death. And if you release too much hemoglobin, yes, you'll have that reduce of oxygen capacity, but the hemoglobin, if there's too much of it, all blood gets filtered in the kidneys. That hemoglobin can actually start to damage the kidneys as well. Like, none of those are good. Now, to know if someone was given the wrong blood, your basic symptoms, fever, and I'm like, not fear, maybe. Fever, chills, low blood pressure, rapid heartbeat, you're nauseous, you're vomiting. These are not great things if you just got someone's blood. Treatment, if all of a sudden they're like, oh my goodness, we just gave someone the wrong blood. One, the biggest concern they have right away is preventing that kidney damage, because once that kidney is damaged, it is damaged. And I'm like, so they're going to try to give you lots and lots of fluids, lots of diuretics to try to flush out. And I'm like, the blood. And I'm like, just filter that blood through the kidneys, but with lots and lots of fluids to not do damage, and try to get rid of that hemoglobin out of your blood. I already said some of this already, but yes, and I'm like, type O is the universal donor, because they don't have any antigens in their blood cells. Type AB is the universal recipient. They don't have any antibodies. Although my misleading is, yes, there are other antigens, whether it's little squares or little triangles, there are other antigens. And and I'm like on blood cells that then can cause problems, usually not death. If someone knows they're going to go in and have surgery, they can do what's known as autologous transfusion. You can pre-donate your own blood. Like, hey, I'm going to go in and I'm going to have surgery, and I'm probably going to need some type of blood because I'm going to lose blood during the surgery. You could pre-donate your blood. They would freeze it so that you can get your exact blood back later on. Then you don't have any problems. When I said before it causes clumping, this is showing what some clumpy blood looks like. And I'm like, so we can do this for blood type. Has anyone done this type of blood typing? I know you. Anyone else? And I'm like, what they're doing is you just take a couple drops of blood, and I'm like, and they put antibodies with your blood. And I'm like, and if you are blood type A, means on your red blood cell you have antigen A, and you add antibody, it will cause clumping. Antibody B will do nothing, because you don't have any antigen B on your red blood cells. And they can look to see what clumps with what antibody. And I'm like, to figure out what blood type you are. And I'm like, so if you're blood type AB, it will clump with both antibody A and B. If you're blood type A, it will clump with antibody A. If you're blood type B, it will clump with antibody B. And if you're blood type O, foreign red blood cells, there will be no clumping whatsoever, because there's nothing for antibodies or antigens to attach to. So a lot of times they do cross-matching. They will take, I'm going to say, I'm like, a donor's blood, and they'll mix it with a patient's blood and see what happens. Like, they'll take the donor's red blood cells, mix it with the patient's blood. They will also take a patient's red blood cells and mix it with the donor's plasma and see what happens, because sometimes you can see clumping in one direction or another. If there is a substantial amount of blood loss, and I'm like, biggest things that can happen, yes, is you're not going to have blood. And I'm like, a lot of times, I'm like, you're going to go into shock from that low blood volume. You are not getting blood. You're not getting fluids to various organs. And sometimes it's not always just about the red blood cells carrying the oxygen. Sometimes it's the fact we just need to get fluid into the blood to have enough blood pressure to make all of our organs work. So occasionally, if they just want to increase the volume of your blood, but they don't have actual blood ready yet, they'll give you a saline solution or an electrolyte solution that just mimics the plasma. If they just want to get your blood volume up as fast as they can, and I'm like, they'll try to give you the red blood cells later, but if they just want to get your blood volume up, and I'm like, so that you don't go into shock, they can give you something other than blood. Oh. Some review questions. I don't think there's too many. 5-ish, something like that. And I'm like, some of this is from last time too, so if you remember. An elevated neutrophil count would be indicative of what? Because neutrophils are known as certain type of slayers, if that helps. Pink, orange, yellow, or green? Time-wise, you can just say it. It's not pink. It's a different one. It's the Y, it's the yellow. Neutrophils are bacteria slayers. Antihistamines would counter the actions of which white blood cells? So which white blood cells are known for making histamine? P, O, Y, or G? Not O. Next? Nope. It's not P. It's Y. Oh my goodness, you guys are so smart. And I'm like, basophils are really the big allergic reaction to white blood cells. Leukemia is the general description for which of the following disorders? Which one? It is O. You're making a whole bunch of abnormal white blood cells that can't do their jobs. The next one, why don't platelets form plugs in undamaged vessels? There's a reason, though. It's O, and I'm like, they have to stick to those collagen fibers, and the von Willebrand factor allows them to stick there. And the last one, which agglutinins are naturally present in someone who is B positive, blood type B positive? There will be a blood typing question on your next exam. It is the pink. Now, and I'm like, if you're B positive, and I'm like, which is great. I love to be B positive. B positive. And I'm like, yes, and I'm like, if you're blood type B, I think I have it over there. You would have A, but if you're positive, it means you have the Rh factor, which means you do not want the Rh antigen on your red blood cells.